Hey, it's Jeremy Triblett, Prevention Integration Manager at Behavioral Health Services, Community Access to Recovery Services. Thank you for joining us. Listen, if you're receiving this PowerPoint, it is because you've applied to receive Milwaukee County's Harm Reduction Vending Machines. And throughout that process, you were selected and you now have a machine, but you don't have your supplies yet. That's because we want to make sure we're thoroughly educating anyone who will be engaging with folks using that machine on how to disseminate and administer all of those supplies. So once again, thank you for being here. Throughout this presentation, I'm going to be facilitating you on each slide, providing you the information. Please make sure you're taking notes if at all possible, because at the end of this, you're going to have to take a quiz that really assesses your ability to retain this information. Thank you once again, and we can get started. I want to introduce you all to the Substance Use Prevention and Harm Reduction staff team. I'm Jeremy Triblett once again. I am the Prevention Integration Manager. I'm working with service areas across behavioral health services. Venetia Kendrick is working specifically in the Community Access to Recovery Services Division, and so is Clarence Jenkins. All of us do different things to ensure the many prevention and harm reduction strategies that Milwaukee County administers is done with excellence and is evidence-based. So please, say hi to the team. They won't be here for the training. I'll be the only one facilitating this, but it's important for you all to know exactly who's behind this initiative. And so many folks may not know this, but Milwaukee County is an entity that houses lots of different divisions. And ultimately, across all of the services and divisions we want to make sure that we achieve racial equity and that Milwaukee is the healthiest county in Wisconsin. Behavioral health services is one service as a part of that. Something we used to be called a division. But essentially, we want to make sure we have dependable, high quality behavioral health services, no matter the severity or the need or the ability to pay. I love that. And then lastly, with inside of behavioral health services, there is community access to recovery services. We provide a range of supportive services to Milwaukee County residents that are rooted in compassion and dignity. Our goal is to eliminate barriers to behavioral health services and increase our community's ability to thrive. Now I want to introduce you all to the Harm Reduction Vending Machine project. This will be some overview information that you can use to really give you a better context of this particular project before we move into the rest of the presentation. Your vending machine supplies will include one poster for each item. They'll be in Spanish when available, 1,000 postcards for each item. They'll also be in Spanish when available. We invite you all to actually add to that list of information if you have some evidence-based or relevant, still up-to-date information related to treatment, harm reduction, recovery, or prevention. We ask that you all provide that somewhere near the machine as well. Many folks have had tables that they put supplies on or posters that they put on the wall. None of those things should cloud the information related to the vending machine, but they should definitely be nearby so that not only are folks getting what they need from the vending machine, and being educated with the postcards and posters, but they're also receiving some local, up-to-date and relevant information related to recovery, treatment, and prevention as well. Now, in each of your machines, you're going to have medication lock bags. Your machine can take up to 50, up to 60 gun locks, up to 60 medication deactivation pouches, up to 200 fentanyl test strips, and up to 60 kits of Narcan. So this work would not be possible if we didn't partner with Vivint Health LifePoint program. They're the ones who's going to hire prevention specialists who will manage the restocking of vending machines, act as a liaison to hosting agencies, and communicate with BHS to ensure the successful management of the vending supplies. And so that's good news to you, and that you all don't have to restock your own machines. We'll have a person who was hired full-time just to do that. You can see here on this slide that not only are they restocking the machine and being the liaison, but they'll ensure that all agencies hosting the vending machines have harm reduction education, printed resource guides, and educational information for the residents of Milwaukee. They'll track all the supplies, and they'll track and report the percentage of machine supplies taken on an annual basis. Another one of our great partners is HRI Vending. For over 30 years, they've been Wisconsin's leader in providing new and refurbished vending machine equipment, services, and parts. They're the ones who are the reason why we were able to deliver your machine to your agency. They provide wider machines and more narrow ones. And if anything goes wrong with your machine, you can always reach out to us. We'll reach out to them to fix your machine. The vending machine host phases are as follows. First, you had to complete an application. We sent out an application via our network and received 30 back for our first year. We're really excited about that. Each year afterward, we'll open up the application process to more industries and businesses and sectors. And folks who have already applied will not have to apply again unless they want to. We'll simply add to the pool and then put them through the entire selective process and see who comes out on top. All right, then we're going to conduct host interviews. We've done that with you already. During that interview process, we ask about 20 plus questions, and then we rank those applications to figure out who in the interview process came out on top as well. Then we're going to complete the vending machine supply training, which is now, you're in phase 3, and then phase 4 will receive supplies and adopt tracking systems. We do plan to offer you all a electronic tracking system, and so I just want you to know that at any point in time we may be using a manual process where a staff person will be assigned to complete a item request form. And that form simply states that, hey, we've noticed in our vending machine 5 fentanyl testers were taken, and we would like to request 5 more to be dropped off, right? That's the manual process that happens on a weekly basis to ensure your machine is always stocked. But when we go automated, we're going to add technology to each machine in partnership with HRI Vending to just ensure that you no longer have to count those things. We'll get an alert that tells us what's missing from the machines, and then we'll schedule a refill with you being aware of that. And so you won't have to dedicate staff time to that. All right, but remember, we're just going to make sure you get your supplies, and whatever tracking process we adopt at that time is the one we'll make you aware of. And then lastly, you want to educate your community. I'm really excited about that, right? And so at the end of this presentation, we're gonna remind you all about what's next, and what is next will include the educating of your community. This is going to be a chance for you all to design a way to engage folks around your building to make sure that they're aware of the vending machine being placed there and what items are existing in the vending machines. We're going to provide you all some literature for that. We ask that you all provide volunteers to help you out with canvassing your neighborhood. Some folks may even decide to do a cookout, right, if it's summertime, or to do an event where they educate people, even beyond the first community education event we plan with you. So we're really excited to see how you all engage with community on a continuous basis, both educating them on the supplies, but also making them aware of your services in that community as well. Now that we've overviewed the project itself, it's time for the harm reduction supply training. Before we begin, I want to make a few notes. The first note is this training does not cover Narcan administration. The harm reduction and prevention team at CARS, we're all trained on how to facilitate that particular training that was done by the state of Wisconsin. We encourage you all to please come to that training. It is virtual, it's happening once a month, and it's on the Teams platform. Come to that training, get trained in that, and that goes for any person in your staff team who needs to be trained on this. If they haven't completed that training, they need to do so. If you have completed it, however, you can always show us a proof of completion, and we'll take that. That will settle that for you all. But the rest of these applies, we're assuming you probably haven't been trained on. It was made newly for this particular project. And so I ask that as you move through this, you be aware that we're going to cover each item separately. We're going to begin with quick facts about each item. We'll begin to walk you all through how to use those items step by step, and then you're going to see a video of me demonstrating how to use that item in real time. After you've gone through each one of these items, at the end of this training, you're going to receive access to the quiz that you should take, and in the quiz, it's going to ask you how it is you use each item. Your goal is to pass the quiz. All of the staff who are going to be engaging with people who will use the vending machine need to pass the quiz in order for you to receive your items. The Deterra deactivation bags are really important for our community. There may be folks who have old medication that they no longer want to use. There may even be folks who are using drugs for which they found out there was fentanyl laced in it, and they want to simply throw them away. They can use these Deterra deactivation bags to put their drugs in and put it into a garbage can. So we're excited to introduce you all to this particular item. When should you throw away your medications? Folks may not know this, but just in 1979, the U.S. Food and Drug Administration began requiring manufacturers display the fill and expiration date on prescription and over-the-counter medicines. There are lots of people to this day who still don't follow those. We know that the mandate has actually been pretty recent in history, and so there is still a culture of people who both use their medications after the expiration date, and they even may share them with other people. We want to encourage you to follow the expiration date listed on your pill bottle. The expiration date can be found printed on the label or stamped onto the bottle or carton, sometimes following EXP, and then once the expiration date has passed, there is no guarantee that the medicine will be safe and effective. What I love most about the deactivation bags is that using them is pretty simple. You tear open the pouch, don't remove the inner pods at all, and then you're going to place your unused medicines inside. You're going to fill the pouch halfway with warm water and wait 30 seconds for air to release. Some foaming may occur. And lastly, you're going to seal that pouch tightly, gently shake it, and dispose of it in your trash. Okay, now that we've gone through the quick facts and how to use them, I'm going to show you all a video of exactly how to do so. I want to invite you to check your bottle. Make sure your medications are not old before you use them again. And ensure that your provider still wants you to use those medications at the same dosage. Let's say for a moment you no longer want to use your medications, or you may have found some illicit drugs around your house and you don't want anyone using those either. We have a solution. In our vending machines, you'll always find the Deterra deactivation system. We call them drug deactivation pouches. There's 3 steps you will have to follow in order to make sure your medications and or any illicit drugs that you may have around are deactivated. Your first step is to simply open your bag. You'll notice on the inside, there are some pods. Don't remove those, but you can definitely put your medications in. Each bag has its own set of instructions for how much of each thing you can put into it. This particular bag has 45 pills, 6 ounces of liquid, and or 6 patches that can go in this bag. Larger bags can go up to 90 pills, for example. Each bag is also perfectly equipped to handle illicit drugs. Whether we're talking about weed or methamphetamines or crack cocaine, all of those things can be deactivated in the Deterra deactivation system. So your first step, once again, is to simply put your medications in the bag. You'll notice on the bag it says to fill the pouch halfway with warm water and then wait 30 seconds for air to release. Some foaming may occur. I'm going to do that at this time. And we're going to wait 30 seconds. I can hear and see the foam. You're going to seal that pouch tightly. Shake it up a bit and throw it in your garbage can. Remember, any medication you have that is old and or illicit drugs that you don't want around, you can always put it in this pouch. There are lots of people who have medications around the house for whatever reason, and they're currently using them, but they're out. Maybe they're on the counter or in the kitchen cabinet or in the bathroom somewhere and anybody can get to them, we know that there's a lot of folks who are introduced to both legal, illegal drugs and prescriptions because somebody else in their house had them laying around. We want to encourage folks in our community to lock those important items, especially medications, away in the medication lock bag. Some of the medication safety tips we want to offer you are the following. You want to keep your medicine in a safe place that is temperature controlled and secured with a lock. That's why we offer lock bags. Only take medicine prescribed to you. Remember, when things are prescribed to someone, it's done so after evaluating their health conditions. You want to make sure you receive that evaluation to ensure that the medication you think you could take is actually not going to harm you and it is safe for you. You want to take medicine only as directed. You don't want to take more medicines than your doctor or prescriber told you to take. You don't want to take them in a way that they told you you should not take, right? You want to make sure you follow all the rules because it's going to keep your body at its healthiest state. Do not share prescription drugs with others. Check with your doctor before taking opiates, particularly if you have breathing problems like asthma or sleep apnea, and don't mix pain medication with other drugs, including alcohol. Your medication lock bag has both a key and a three-number combination on it. In this particular training, we feature the keyed access because it's most simple. Most people know how to do that. In your bag, though, when you open it, you're going to receive the keys, but you're also going to see instructions on how to set the three-part combination. We want to encourage you to do that, set the three-part combination if you wish, but we also want to show you how to use the keys because it usually is a lot easier for most people to do it that way. So the first thing is you want to open up your bag. First, collect all of your prescriptions in a neat place, pull the zipper away from the lock, and then insert the key into the lock and turn the key clockwise until the lock pops open. Your bag is now unlocked. Afterwards, you want to put all of your medications inside the bag, pull the zipper up against the base of the lock, and then lock your bag by inserting the key into the lock, rotating it counterclockwise, and then pushing down until you hear a click. So these are your written instructions. I want to give you a chance to watch the video of me demonstrating this to you live. Milwaukee County has partnered with Cardinal Bags to ensure our community members have exactly what they need to lock away their medications. Many people either keep them under their beds or in their nightstands or in their bathroom cabinets. That isn't as secure as you may think. Lots of people get introduced to drugs because they find them laying around at home. We want to make sure we lock them up securely and that nobody else can get to them. First, you want to grab your bag from the vending machine and unzip it. You're going to notice inside there are two items, your instructions and your keys. Now that you have both of them, you can always use your instructions in order to both lock the bag, unlock the bag, and reset the 3-digit code. You'll get two keys. You can keep one near the bag, and you can keep the other in a secure place. Your intentions are to never lose your keys. Otherwise, you're only going to be able to use the three-part combination. Now let's take a look at your bag. You're going to notice that there are two colors on the switch. There are green and red. And you're going to have a three-part combination that has three numbers to it. You want to set those to 0 in order to open your bag for the first time. After that, you simply turn the knob to green and you'll hear a pop. Open your bag, place whatever items you want to in your bag, and simply close it back up again. You want to make sure your zipper is close to the knob. Turn that 3-point combination over the zipper. Turn the lock to red so that the red is pointing toward the 3-part combination and press it down. You're going to hear it click again. That's how you unlock and lock your bag. You're receiving your vending machine at a time when fentanyl is being laced on all kinds of drugs. We recognize that fentanyl is actually used in prescriptions. And so we don't consider fentanyl in and of itself a danger to the public when it is regulated. But when it is used illicitly and or created synthetically, we know that folks can weaponize it to increase the number of people who are addicted, and that in turn increases the number of people who ends up dying from overdoses. And so at this point, we're featuring fentanyl test strips. In the future, if there are other testing strips for other kinds of drugs, we are more than open to including those in your vending machines as well. Before instructing you on how to use the fentanyl test strips with different drugs, I first want to give you some quick facts, right? The first one is that you could overdose even if the testing strip says there is no fentanyl in your heroin, cocaine, or other street drugs. This particular device tests your drugs. It will not prevent you from having an overdose if you take your drug. Okay? That's with fentanyl in it or not. While it is advisable to test street drugs for fentanyl, there are no well-researched, established recommendations on how to test drugs with these testing strips. We do know that people do test them and that they do have a higher rate of coming back accurate, right? But there is no well-researched, established recommendation on how to test drugs with the testing strips. Testing strips can produce false negative results. Only 6 forms of fentanyl can be detected by using testing strips, and other toxic contaminants will go undetected. And if the testing strips identify fentanyl, the actual amount of fentanyl cannot be determined. And so we don't want folks to assume that when they use this, it's going to tell them if they have a lot or a little. It will not. It will only tell them if there is something present. At that point in time, it's up to the person to choose to take the drug or not, get new drugs and or use the Deterra deactivation bags to throw those drugs away. Here's how you can use your fentanyl test strips when you plan to inject your drugs. You want to insert your shot into a new cooker, into a syringe, and keep the cooker. Don't shoot up yet. Set the loaded syringe aside and add 1 milliliter of sterile water into the cooker and stir the mixture. Holding a testing strip by the blue end, insert the end with the water lines into the solution. Don't go past the blue line, and do that for about 15 seconds. Wait for a full minute to 2 minutes to see your results. When it comes to crystals or powder drugs, you want to measure a level of 10 milligrams of micro scoop of a drug and put it into a cooker. Add 1 milliliter of water and stir the mixture. Holding a testing strip by the blue end, insert the end with the wavy lines into the solution. And then wait for 4 minutes to 2 minutes to see your results. When it comes to methamphetamines, you want to crush 1 tablet and place it into a clean cup. You want to add a tablespoon of sterile water, stir into the solution, and then go to step 3, which is hold the testing strip by the blue end, insert the end with the wavy lines into the solution for 15 seconds, and then wait for a minute or 2 to see your results. No matter which drug you're testing, the test will read the same. If it is positive, fentanyl or similar synthetic opioid has been detected in your drug. And if you are not planning to use fentanyl or opioid, avoid using the drug, right? So remember, a positive one gives you 1 line. The first line on there only tells you when it's positive. Now, when it's a negative test, you're going to see 2 lines. A negative test is when fentanyl or a similar synthetic opioid has not been detected in your drugs. Remember, no test is 100% accurate, and your drugs may still contain fentanyl or a similar synthetic opioid, right? An invalid test is going to show you either 1 line or no line at all, and you just want to retest your drugs with a new strip if you see that, and don't use test strips more than once. We recognize that there are a lot of people overdosing on drugs that are laced with fentanyl. It's important for us to make sure everyone has what they need to test their drugs before they use them. We're going to talk about how to use fentanyl test strips. Your fentanyl test strip kit will have a canister and a vial of water. Put half of that water into the canister. You're going to take your peel and you're going to put it in the water. Afterward, you take your fentanyl test strip and you're gonna place the wavy side into the water. Stir and sing happy birthday. Place your test strip somewhere safe and wait about 2 minutes to see what the lines indicate. Suicide and substance use often go hand in hand. Many people who die by suicide do so after either shooting themselves or injecting or using some sort of substance. We've included the gun locks into the vending machines because there may be some folks who want to use them to lock away their guns and ensure that if someone wants to die by suicide, they cannot do so using the gun in their home. It's also really important to lock up our guns because when folks are using drugs, especially illicitly, we want to make sure they don't get their hands on a gun and while under intoxication or under an influence of a drug, end up ending a life. Here are quick facts around suicide in Wisconsin. In 2019, there were 427 firearm suicide deaths in Wisconsin, including 22 children and teens. Suicide rates were significantly higher in dark red counties when compared in the state between 2015 and 2019. And the means matter. When we talk about the most commonly used method of suicide between 2013 and 2017, we know that firearms were number one, suffocation afterward, poisoning, and then other after that. Prescription medications were the most common substance group determined to contribute to death amongst poisoning suicides. Alcohol was the most commonly detected substance amongst firearm and suffocation suicides as well. Firearm was the most commonly used method of suicide between 2013 and 2017. Here's how you want to use your gun lock. First things first, always unload your firearm and put the safety on before locking it up. For pistols, use the cable lock through the ejection port and magazine slot. For shotguns and rifles, use the ejection and loading ports. For revolvers, use the barrel or 2 chambers in the cylinder. Store the key and the cable lock separately from your firearm. Always make sure your gun is empty before locking it up. Remove the magazine and check for the chamber. Engage the safety if available, and always treat every gun like it is loaded, even if you don't know, even if you know that it is not. Never point a gun at someone else, and always keep your firearms away from children. You want to unlock the cable lock, insert the key and turn it to the release the cable. To prevent accidental firing, push the cable through the gun and keep the chamber open by racking the slide. Pass the cables in through the ejection port. To secure a firearm, pass the cable lock through the appropriate opening, such as the ejection port or barrel, and then for a revolver, pass it through 2 chambers or around the frame. Remove cable locks to load and fire the gun. Thread the cable out bottom and guide through the magazine slot. Insert the cable into the lock, connect it to the gun, and twist the key to secure it. Make sure that the cable lock is secure by tugging on the lock mechanism after you lock it. And if the cable releases and opens up, try locking it again. To keep your firearms and ammo safe, store the key to your cable lock separately from the gun. Lock them with the cable lock and store them in a gun safe out of reach of children. Now, for your next piece, you're going to watch a video of me putting a cable lock onto a gun. Milwaukee County's vending machines also include gun locks. These gun locks are important because what we know is that many people in our community die by suicide. When people want to use guns to die by suicide, we know that a gun lock being on the gun first slows down that process. It gives them more time to think and reconsider their decision. When you open the white box, there's going to be your gun lock, your instructions, and your keys. First thing is you simply want to open up the lock. Take one of the keys, turn them to the side, and pull the lock out. We always recommend that you keep your gun in a safe and secure place. Many people may keep their guns in a gun safe or gun box that is also locked. Even if you have a lock on that particular place for keeping your gun, you always want to make sure you include a gun lock on the gun as well. For the purpose of this demonstration, we're going to use a 9mm gun. You're going to take your gun and make sure you release the magazine so that there are no bullets inside. And as always, you want to make sure you check the chamber to ensure there are no bullets left in the gun. We invite you to use your finger and poke them into the holes just to make sure there's nothing there as well. Now that you're sure there are no bullets in your gun, it's time to put the lock on it. Pull back the clip, put your lock through the chamber, and then you want to simply put the cord back into the lock itself. Afterwards, you take your key, lock it up, and then make sure you put your key in a place that you can remember where it is. Thank you for completing this training. We hope that you appreciate it, found some of the information relevant and new and easy to follow. Your next steps are you're going to pass the post-training test. That link is provided in this PowerPoint. You're going to schedule a supply stocking meeting where we'll come to your agency and stock the vending machines with you so that you're very much aware of how to do that. And then we're going to plan a community education event where you're able to educate your community on the vending machine and the supplies along with the services you provide. Thank you. I'm Jeremy Triblett, Prevention Integration Manager. If you have any questions, you can always call my cell phone at 414-355-1460 or email me at jeremy.triblett@milwaukeecountywisconsin.gov.